Hi guys, so I wanted to quickly come to you. It's been a while. Don't mind the white stuff in my eye. I just pulled off my fake eyelashes. So I wanted to come and talk to you guys about what's been going on with me. Just a quick update. It's been a while, like I said. Okay, so a quick update. 7 months post lumbar fusion, still having a lot of lower back pain, severe sciatica or radiculopathy, like they call it. So I'm having intense nerve pain in my lower back, in my right buttock, my right thigh, my right calf, and both of my feet are numb and tingling all day. So I went to the doctor, my pain doctor, and he ordered an MRI and suggested that I find an orthopedic surgeon, because I haven't seen a surgeon since having my surgery at Laser Spine Institute in January. I haven't seen a surgeon since then. So I can definitely say since I've had my surgery in January, I have not been pain-free. I haven't experienced the great recovery that a lot of people have after having a lumbar fusion. So yeah, lots of pain with that. I found the orthopedic surgeon. He read the MRI but said he needed a CT to see what was really going on, and also a nerve and muscle test. So I did get the CT, and it revealed that I do have foraminal stenosis at L3, L4, L5. So that is a pinching of the nerves. So it says foraminal stenosis with abutment of exiting nerve root. So at those three levels in my lumbar spine, L3, L4, L5, the nerves are being pinched, I guess by the bone or the vertebra. I'm not 100% sure because the orthopedic surgeon hasn't said it yet, but it's being pinched, compressed. The nerves that are exiting into my lower back, my buttock, my legs, they're being pinched at three levels. Maybe it's a result of the surgery, I don't know. But when I did go to get the nerve test, which is very painful, it's the second time getting it, they like electrocute you with like this little taser gun looking thing, send shocks through whatever part they're testing at different levels. And then the muscle test is they come and stick needles, like acupuncture needles, into different areas that they're testing just to see if there's muscle loss. So that test was negative. She said my nerves are not damaged yet, but that's why it's important to get this impingement or compression taken care of to release the compression from the nerves. Number one, because the pain is ridiculous. I can't stand for long, can't sit for long, can't lift, can't bend fully. The sciatica is ridiculous. I get horrible calf cramps in my right leg, sometimes my feet. I do have weakness and tingling. I'm just not living my best life right now. And so the CT did show that I have that, and the MRI showed that I have epidural scarring. Both the MRI and the CT showed that one of my screws is kind of out of place, and the orthopedic surgeon told me that he needs the MRI, the CT, and the nerve test to determine how he proceeds. When I spoke to my pain doctor, he told me there's only really two options for this, which is 1, injection, and 2, surgery. I've had 20 injections in my lower back before even getting the surgery. Very painful, very expensive. None of it helped. Different injections: epidural, steroid, medial branch block, sacroiliac. I've had different injections, and that's not even counting the 3 that I had to deliver my 3 children. So I don't think taking any more injections in my lower back is going to help me. If anything, it's probably hurt me, and it's probably one of the reasons for my scarring, the epidural scarring in my back, in addition to whatever I went through for the lumbar fusion. So I don't know what he's going to tell me, but I know I need this pain to go away because I cannot deal with it. I had the surgery to get rid of my low back pain. Now I have this pain. It's horrific. I'm not taking anything for the nerve pain like gabapentin, Lyrica, none of that stuff, because none of it was really helping me, and it was all just making me sleepy and groggy and causing me, see this, to gain weight. I would have dealt with the weight gain if it was helping me significantly, but I'm not taking any type of nerve medication. I was off of all type of medication for over a week because I went and got my marijuana, my medical marijuana card. So I went to Satura Wellness, which is a medical marijuana dispensary, Satura Wellness, and I did get a few different types of vape pens to vape the medical marijuana, because I do not want to smoke it. I was approved for smoking, for edibles, for topicals, but I do not want to smoke the marijuana because I'm just not a smoker. I don't want to do that to my lungs. I don't want to. They said vaping is much better, so I chose to vape. I didn't choose edibles yet because I heard it takes a long time to kick in, and you don't really know when it's gonna kick in. And I have children. I can't be you know, just not coherent or whatever. So the one that I'm taking, I have a daytime pen, vape pen. It's called Revive AM. It's supposed to be medicinal marijuana that is for pain relief, for nausea, for stress, for anxiety, for depression, and it's supposed to give you kind of like energy and focus. That's what's called AM, so you could take it during the day so you can carry out your duties. That is not the case. It still makes me very sleepy and tired, so I'm barely taking that during the day. Minimally helps with the pain because I only take, like, I don't know, one draw every couple of hours, because I cannot take more than 2 draws because I will be asleep, and I have a 3-year-old that I'm with all day. The second one I have is called the Zen vape pen, and it's supposed to be like you know, like a balance of I think it is THC and CBD. I might be getting that wrong, so let me just show you guys really quick. Bear with me. The ones that I have. So the reason why I'm trying medicinal marijuana is because I've tried everything. I've tried every type of pain pill, every muscle relaxer, every nerve medication, and all it's doing is probably messing up my liver and my kidneys, because it's been years that I'm on everything, and I just wanted something a little more natural and healthy. But you know, I'll tell you, so far I'm not getting a whole lot of relief. So this is, excuse the bed, that's where I spend a lot of time. This is Revive AM, and you see it comes like in a little prescription bottle because this is prescribed by a doctor. All right, let me just open it. Bear with me. I have nails on, so it's kind of hard. This is the vape pen, guys. Okay, so this is Satura Wellness. That's the dispensary, and this is the Revive AM pen. You're supposed to, this is, see, this is the oil here. Cannabis, guys, medical marijuana. That's it there. It was full to the top when I first got it a couple weeks ago, but I'm not using it a lot. So it's supposed to last 10 days. It's been over 2 weeks. Revive AM. So this is supposed to be for the morning. Now one draw is 2 seconds of inhaling. So if you inhale for 2 seconds, that's 1 draw. The daily dose is 9 draws. No. Okay, that's the daily dose. I'm a mess, guys. I'm under a lot of stress, a lot of stuff going on. That's the morning pen, Revive. That's from Satura Wellness. This is the midday pen, I guess, or anytime pen. This is, let's see if you can see it. Does it have it on it? Okay, hold on, guys. I'll take it out. Okay, so this is Zen. So it has 1 CBD to 4 THC. So this one's a bit stronger than the Revive AM. You see, I have a lot more than that. It's stronger. I usually take this midday if I'm going to take it, to try to like mellow out if the pain has become too much. This is Soothe. Now this one, I've noticed this one works the best for my pain, and this is 1-1. So for every 1 milligram of CBD, there's a 1 milligram of THC, so it's very even. I guess this is what you call a hybrid. I mean, there's an equal amount of both CBD and THC. So this is the Soothe, and this is supposed to really help with muscle pain, with just pain in general, tension. It's supposed to kind of like soothe your body. So I use this towards the evening time. Again, it's the one that's used the most. See, this is the one that I use the most because I find it's helped me the most, and it doesn't make me all sleepy and like out of it. So, and then the one I use for the nighttime for sleeping, to kind of be able to sleep through the pain, is the Relief. Okay, it's the blue bottle. Relief. So it has 1 milligram of CBD to 9 milligrams of THC. I hope I'm saying that, 9 milligrams. So at night, I usually about 8 o'clock, I'll take 1 draw, which is 2 seconds of inhaling. And then maybe like an hour later, if I still feel like I can't fall asleep, I'll take another one. And it usually helps me sleep if I fall asleep around 9:30. By 1:30, I'm up using the bathroom. And so it doesn't help me sleep completely through the night, but for a couple of hours. So I'm really having a hard time with my pain in the morning through the midday. So I can use these towards the evening and night, and it'll help me with my pain. But the morning time, this Revive AM, that's supposed to be for the morning time, for me, it's still making me very tired, very sleepy. So I did speak with my pain doctor. I was very honest with him about going with medical marijuana. I just started. It hasn't been even a month of me using medical marijuana, so I don't really know what works best for me yet. This is only the first company I try, Sotera Wellness. The next company I plan on trying is Grow Healthy, just to see what works for me. I think maybe in reading and researching sativa, which is supposed to be for like a daytime medicinal use, it doesn't make you kind of groggy or whatever, sativa I think would be the best thing for me to try. And maybe high CBD, yeah, because the one with higher THC, that's for the nighttime, that's not for the day. I can't really do much with that. So I did speak with him. I was honest about it, and he did allow me to continue on tramadol, but only 3 pills a day, until the orthopedic surgeon decides what he wants to do with my back. So given the fact that I am in pain, I have nerve compression, I know I don't have a whole lot of options. Injections haven't worked for me in the past, so unfortunately I may be looking at a surgery. I don't know if they're going to do another fusion, or if they're just going to try to put something in there to take the bone off of the nerves, but that's what's going on with me so far. I do live in South Florida, and we're actually preparing for a hurricane. So hurricane's supposed to hit this Sunday, South Florida, Hurricane Dorian. So we're preparing for that. I'm just taking it one day at a time. Still not working. Still going to a lot of doctor's visits to try. I'm hoping that once the nerve pain in the lower back is taken care of, I can kind of deal with my fibromyalgia and try to just like have some type of normal life. I still have a lot of health concerns, still have a lot of health problems, still losing my hair, still sweating when I go out in the sun, a lot of issues, but one day at a time. I'll let you guys know what the orthopedic surgeon says if I do need surgery again. Yeah, and I'll see you guys next time.